They're running more simulations, essentially.
They're iterating the science faster because they're running the experiments faster.
And manufacturing faster, too.
Yeah.
I was reading about this fast car technology in the notes. This was developed by Gracell, which I believe is now part of AstraZeneca.
Yes, AstraZeneca acquired them largely for this tech. FastCar is revolutionary because it attacks the vein-to-vein time.
Vein-to-vein, that's industry speak. Break that down for us.
That's the clock. It starts ticking the moment they take the blood out of the patient and stops when they put the engineered cells back in. With traditional CRT, that whole process takes weeks. You take the blood, ship it, engineer the cells, grow them in an incubator until you have millions of them, ship them back. It's a 2 to 4 week wait.
And for a patient with aggressive leukemia, 3 weeks is a lifetime. You might not have 3 weeks.
Exactly. Patients can die waiting for the truck to arrive. FastCar cuts production time down to 24 to 36 hours.
From weeks to a day and a half. How is that even physically possible? Don't the cells need to grow?
That's the innovation. They skipped the expansion phase. Usually you have to grow the cells in the lab for days. FastCar engineers the cells and puts them back into the patient almost immediately, letting the patient's own body act as the incubator.
So the patient becomes the bioreactor?
In a sense, yes. And it's actually better for the cells. They're younger, less exhausted, more aggressive when they hit the cancer. And crucially, it drives down the cost.
Yeah, let's talk numbers. Because financial toxicity is a real term now. The sources put the cost of the product alone in the US, just the bag of cells. It's somewhere between, what, $373,000, $475,000?
Correct. And that doesn't include the hospital stay, the ICU time if things go wrong, or supportive care. That's just the drug.
And in China.
The commercial price for similar approved products is landing between $120,000 and $170,000, so already less than half. But here's the kicker. Because of that IIT track we mentioned, track 2, if a patient enrolls in a trial, the therapy itself is often free or heavily subsidized.
So you have a domestic supply chain, faster manufacturing. It all leads to a fraction of the U.S. cost.
Right.
But I want to be careful here. We don't want to paint this as just the discount aisle of cancer treatment, because usually when things are cheaper and faster, they aren't better.
Absolutely not. And that is the crucial distinction for 2026.